Hey everybody. Okay, this video, I'm trying something out. Someone said to me last night, just as I was going to bed, that the last video, they thought I looked like shit. And I mean, I was right in front of beautiful sunlight, and I'm just unfortunately someone who's got a face that sometimes doesn't look good in the sunlight. I don't know. So this video is a bit of an experiment to see how this looks, but way more importantly, I want to talk to you about what I think is probably the biggest news right now in Canada. That is Manulife, the insurance company, has inked a deal providing exclusive distribution with Loblaws. Healthcare in Canada is public. We say this all the time, but the reality is it's actually not. It's so private. There's so many private delivery mechanisms within the system that we've come to accept or that we don't even see or know about. And the insurance industry plays a huge role in this. When we talk about the cost of drug prices and the need for a national pharmacare program, we're often talking about the need for mass purchasing or bulk purchasing of drugs to reduce the cost of the drugs and make sure that users are not actually paying for their drugs, that it's part of a national medical care system, right? Medicare should include pharmacare. And there's a whole history for why it wasn't included and whatever. So this is the big fight. But here we have Manulife saying that for some 260 drugs that are more expensive, drugs that people who might have cancer or osteoporosis or Crohn's would need, that they are going to push the people who have Manulife plans to only purchase those drugs at Loblaw's pharmacies, which is code for Shoppers Drug Mart. So I mean, aside from what's super obvious, not everyone lives near a Shoppers Drug Mart. Not all communities have Shoppers Drug Mart, although that argument's a little bit tough because increasingly, I mean, Shoppers is everywhere. But it's obviously completely true that rural, remote people who don't live anywhere near a Shoppers will be forced to then get their drugs. And then Shoppers would say, oh, but we'd mail them their drugs. So this is not a problem. Like, relax. This is a disaster. This is a disaster policy, and there's a reason why it's illegal in Quebec. We have a right to decide to go to the independent pharmacy up the street or to the Shoppers if we really feel like we got to go to Shoppers to get our medicine. And the insurance companies should not be able to dictate where we go and purchase medicine. I mean, again, all of this is ridiculous because we're supposed to have a pharmacare plan, but we don't have that, and I'll get that to in a sec. So this is not like the first time, right? TELUS Health, which if you listen to the Daily News I mentioned this morning, like how horrifying is the idea of TELUS Health, right? Like you're already destroying our budgets with your cell phone bills and eventually what we're all going to have to pay TELUS for our doctors. Oh my God, imagine. TELUS Health was slapped by a commission in British Columbia for actually providing physician services because they get around the law by providing all of the extra services that healthcare doesn't cover. So everything from physiotherapy to massage to whatever, probably eye care and dental. I don't even know, whatever. TELUS Health. They haven't come out to Quebec yet, so this is not a company that I have any direct experience with. I'm sure you might. And to see the snake coiling itself around our public healthcare system in these ways is horrifying. It's so abhorrent. And the thing that they're doing is they're trying to make it even more difficult for governments to create any kind of pharmacare program. As I said, in Quebec, this is illegal. You can't do this. We also are the only province that actually has a pharmacare program to an extent. So where does then federal government, federal politics, federal politicians come into this discussion? Well, this is where it's very interesting with healthcare. It's a provincial jurisdiction, as we all know, but Manulife and Shoppers are operating extra provincially. They're operating federally. They're operating in many different jurisdictions. And this is one of the sneaky ways that privatization gets so good at figuring how to get into the Canadian system. If you have experience operating hospital or clinic systems in Alberta and British Columbia and Ontario and Nova Scotia, you can improve your practices. You can make your practices really responsive and strategic. No hospital system in Canada has the same ability. The Toronto General Hospital can't operate in Montreal, and the Royal Jubilee Hospital in Victoria can't operate in Calgary, right? That's how our system has been set up. And so it allows these private operators to come in to maximize, have economies of scale, purchase large quantities of stuff to be able to operate across jurisdiction, get the practice of practicing across jurisdiction. Yeah, I guess I can say that. And they start to get better at offering healthcare than the public system is able to do. This is the plan. And so here we have another way to force Canadians to be at the mercy of Loblaw Incorporated. It's not good enough that they can, run us into the ground with their food prices. It's not good enough that on every single corner in a lot of this part of Canada that all you've got are Shoppers Drug Marts everywhere. I mean, in Quebec is Jean Coutu, so it's not much better, but it's not Shoppers. And we're supposed to accept this. When I was in the UK this past summer, and I realized when I went into a pharmacy because I needed to get sunscreen, that it was like, wait a minute, it's so weird to be in a society without a pharmacy on every freaking corner. Like, maybe Canada's got a problem with our obsession with the monetization of the pharmaceutical world. Whatever. We need to fight this stuff. And, that takes citizen mobilizing, and every one of my videos says this, but there is a party that actually could make this an election issue, and that is the NDP. So the NDP gives the Liberals their majority in what I think is like the most effective and quiet coup in Canadian history. The NDP gets nothing for it. Nothing. They get promises, right? And the promises are like, oh, dental, like your dental care is going to be whatever. Fine. They then don't do anything. The Liberals continue to jack up the spending that they're doing on the military. Their entire response to Gaza has been horrifying. And every single time someone suggests to people in the NDP, when are you going to use the leverage that you have in this agreement to actually force the Liberals to do something good? The response that we get is, oh, you want to go to election now? You want to hand the election over to Pierre Poilievre? You want to go to the election now? The hell's wrong with you? It's like, guys, it takes a bit of courage for sure. But do you think that the Liberals are in a place to go to an election right now? Do you honestly think that the Liberals, in their tanking in the polls, their massive unpopularity with people that handed them power, right, in many different ridings across Canada, they're going to go to the polls because they don't want to outlaw something that the vast majority of Canadians would find abhorrent and disgusting, this collusion between insurance companies and Loblaws, my God. The Liberals would never go to election over that. They would never go to election over their record on Gaza either. We know how many Canadians are horrified by the destruction happening in Gaza. So whenever someone from the NDP says, oh, you just want to hand this to Poilievre, that's not what's happening. That's not what would happen. And even if it did happen, that's democracy. That's supposed to be how this works. Sorry, guys. It's supposed to be how this works. And if you haven't done the work between 4 years or the 3 years that you've given the Liberals carte blanche to do whatever they want, that's on you. That's not on us. And we should not be held hostage because you haven't done the organizing. We should not be held hostage because the NDP is satisfied to have the most boring and uninspired and worst politics holding leader that the party's probably ever had. I mean, come on, let's be serious. So pay attention to this news. I know a lot of people, I talked about this on Twitter, people responded to me saying, oh my God, yeah, I already have exclusivity deals with my insurance companies and this has been in place for a while now. Yes, these plans, these agreements, they already exist and they're growing. And if we don't stop it now, trying to stop it in 20 years is going to be even harder. So to the NDP folks watching this, whether or not you're elected or you're a member of the party or whatever, can you find some courage somewhere? Because you're so involved in this. And it is not good enough for someone like Don Davies to be like, this is abhorrent. My guy, you are holding up the structures that allow for this to happen. Make it impossible for the Liberals to not pass a law to outlaw these things. Do something. Try to do politics for once. I don't know. All right. I think I look better. Don't I look better? Maybe I don't look better. But you know what? It like part of it doesn't matter how I look, right? I actually don't care. But I was pretty harshly lit in the last one. It's true. So we'll see. art in the background from David Hannon, a Toronto-based artist. If you like what you see, subscribe, share this video. Share this video, especially people who are confused by all of this, who don't understand what's happening and what the ramifications are. Though I think that most Canadians initially hearing this information will be like, wait, what? And when we're seeing these kinds of collusion between the public and the private in Canada, it's the exact same thing that's happening with Staples. It's the exact same thing with Ontario saying Service Ontario kiosks are now going to be inside Staples. And they choose Staples and not the public library for a reason. Right? It's all about profiteering. That's the name of the game in all levels of politics in Canada right now, is profiteering. Who can we sell our services off for at the highest price or even the lowest price, because we don't care. We just want them to get rich. Okay, so maybe the highest price, and let Canadians suffer the consequences.